Alrighty, welcome again. Welcome back to the amphitheater. I hope you all had very productive side sessions. I surely enjoyed the one I was attending on climate change, mental health, and the different research efforts that are happening around the world in that sense. It is this evening my pleasure to introduce to you Don Carlos Alvarado. Before I do that, I want to welcome everyone that is joining us online. Of course, we have a large number of people that are joining us online. This is a hybrid event, so we're really excited about the turnout in our online events so far. Now, I would like to introduce someone that I admire a lot and that gladly is joining us today in person, who is a former President, Don Carlos Alvarado, who will provide the closing remarks for today's Planetary Health Annual Meeting, Day 1. Remember that yesterday we have kind of a pre-Congress or pre-conference day. Now, President Alvarado was 48th President of Costa Rica. He led the country in contributing to global efforts to combat climate change and defend human rights, democracy, and multilateralism. He is a recipient of the 2022 Planetary Leadership Award by the National Geographic Society for his outstanding commitment and action toward protecting the ocean. And in September 29, he received on behalf of his country that Champion on the Earth Award for policy leadership presented by the United Nations Environmental Program. In November 2019, he was named one of Time's 100 next emerging leaders around the world who are shaping the future and defining the next generation of leadership. Now, you know I'm Costa Rican, so I'm also very happy to have him here. Now, Don Carlos Alvarado, Don Carlos as we call him in Costa Rica, he's now a professor in practice in Tufts University at the Fletcher School of Diplomacy. He's leading courses on small state diplomacy. He's also doing leadership courses. And today, we're very honored to have him provide these closing remarks. Welcome, Don Carlos. The stage is yours.
Thank you very much. I want to thank the organizers and for having me and inviting me to this conference. And it's always challenging for me to address an audience that's filled with scientists and practitioners and people working on the field in several parts of the world. That makes me think, what is it that a politician could say that really makes sense or matters? So I'll try to stand up to that challenge. And if there is something that in the next couple of minutes that I'm setting, actually, that I can say that makes sense or that plants a seed inside of you, perhaps I've done my work. I think that for most of us here, both present and the ones that are joining us online, human rights and science are within the greatest accomplishments of humankind. Science as a way of looking at the world, trying to find out the truth about things. Always through the scientific method, leaving the door open to recognize that we might be wrong. But through that method of constantly testing, of reviewing with other peers, advancing the frontier of human knowledge. And through that, hopefully, to improve the life of people around the world, to make humankind advance. Human rights, on the other hand, a moral recognition of not only the individual, but all of us as people, and the recognition of equality between gender, between races, between different ethnicities, between different religions or beliefs, and recognizing that in front of power of the law, anyone in the planet deserves that respect and deserves to be cherished by the mere fact of being a human being. Those are two of the greatest accomplishments, monumental accomplishments of humanity. And then again, in a world so polarized as the one we live in, why is it we wonder that, or perhaps we wonder, and by we, I'll refer in a bit what I'm trying to say, that so many don't really follow or defend what science points out, let's say perhaps in the political arena, and many others do not defend, actually do the contrary when it comes to human rights. Why is it that we, as a whole, neglect so much on science and we neglect human rights? So let's go a little bit on the we. By the first we, I meant actually us here, gathered in this room, and the ones that are online. Because I think that by the mere fact of you being here in something related to a planetary health alliance draws already a profile of the people that are present in this kind of event. I might say that perhaps it will be bold, but I might say that 99% of the people here kind of believe in science, right? Chances are. And I might say perhaps the same about human rights. But I tend to think as well that high percentage of people here have gone through a university, right? Have a college degree from their own country or from someplace else. And that most people here speak at least 2 languages, 1 or 2 languages, maybe more. And I won't go further on the taxes you pay either here or... But that's not the case for all of humankind. When we talk about the other we, the larger we, it's the one that sometimes we confront and we see those elements of polarization. We can see them here in the United States. We can see them across Latin America. I was just coming yesterday from Brazil as being an observer to the election in Brazil. One of the things that really, I can now get into that, but on the break, I can go public on my views. One of the things that really strike you when I got there is how polarized the country is. Actually, if you go to see the actual voting, the difference was, well, Brazil is a huge country, but the difference was 2 million votes, but the percentage of difference is less than 2% difference. I mean, it's basically roughly 60 million and 60 million, less 2 million. That level of polarization. That to say that science and human rights, when it comes to its actual enforcement, think about, for example, the pandemic, has a lot to do in how we put that into practice through politics, but also how society accepts many of the outcomes of what is produced out of it. We perhaps might come from a tradition in which there is an acceptance, or there was an acceptance of many of the postulates of science through authority. Traditional framework, the doctor relating with the patient. This is what's best for you. And there's a leap of faith accepted, mostly by the patient, saying, okay, this is what's good for me. I remember talking with my Minister of Health in 2019, and I remember telling him, you need to go more on television. And he said, but I don't like television. I don't like being in front of cameras. And I said, you need to be more in front of cameras. And he said, why? And I told him, well, because you know what is it people need to do in case of an emergency. But most of all, people need to believe in you. You're like the pediatrician of the country. And he said, but you know, President, I don't really like that. And I remember saying that in 2019, and I said, I mean, come on, let's think hypothetically. If a pandemic were to come, people need to trust you. And actually now he's one of the most renowned persons in the country, Daniel Salas. Why? Because he was on television day and night, telling people to wash their hands, to get vaccinated, you know, the whole drill. And many people believed in him. Costa Rica, we got 85% of people vaccinated with at least 1 dose, and 82% with at least 2 doses. That being said, 75% of the population heard that vaccines might have a digital chip on them. 75% of Costa Rican population heard that. And 1/3 of that 70% thought it was true. The criteria of authority for matters related to science, to climate change, to human rights, is less a tool to persuade people, because the promise of democracies or of governments, but let's say democracies, delivering for everybody, it's a promise that's been broken. And that we is very diverse, but it's very unequal as well. And for some, what it's evident as data, as evident as a paper in a journal, or as truth that can save lives, for others is not anymore the case. It's actually an imposition. And I know for some, particularly the ones that are being trained as physicians or as scientists, that may come could provoke kind of a resistance as a statement, but that is true. And I think that also both for scientists and for politicians, has to be a humbling moment that we need to understand that part of our job in public health, in policy enforcement, in climate change, has to do with not only coming up with the better scientific approach and practices, but with the ability to connect empathically with the others and persuade on why this is the best in terms of life and in terms of protecting families, in terms of growth. That's one of my first key, or perhaps the main key takeaway that I believe I can share. The necessity of being humble in trying to relate. Because those things that, for example, in the case of public health are perhaps evident for practitioners. You know, one of the striking and beautiful things about the practice of public health, vis-a-vis, let's say, working in a third-level hospital, is that most of the solutions that a professional in public health will give you as a community or as a politician are way less expensive and more impactful than many other measures that you will receive. And then again, Why is it that it's so hard for people to follow those advice? Politicians love a big, huge hospital, even though data shows that it's better to invest in certain areas of prevention. But how you share a narrative, visualizing, I mean, you don't start a policy of prevention with a huge hospital on your back. So how we can connect people to change that behavior, knowing that if you want to go to the actual benefits of population, the public health program will be the one to go. How can we relate to communities that are exposed to all this fake news and false information? And in the process, not using authority arguments or even unpacking the science to make them see what for us is evident, but how we can relate through empathy to share with them the gifts that both science and human rights have provided others. That's one of the greatest challenges. And I don't believe there is an actual course on scientific course, perhaps there might be, on how to empathically do that and change behaviors and diminish the huge divide there is today in societies. That has a lot to do with inequalities as well. If we want to think about in terms of health and environment, we need to think about governments. I've been talking about things that relate a lot with politics, but also with democracy, but also in income, for example. There's a huge divide. Inequality is part of this. Lately, there was a report from the World Wildlife Fund, WWF, and it said that in the last 5 decades, wildlife has reduced the number of vertebrates, mammals across the world. The populations has reduced in the last 5 decades in a 67%. We're talking about extinction. 5 decades. What took millennium in 5 decades has reduced 67%. In Latin America only, the reduction is more than 90%, the most dramatic in the world. That's what happened with the library, the DNA library, and of our living companions in the planet. That's what's going on now. Climate change, driving migrations. But are those migrations going to impact whom the worst? The poor people of the world. The poorest are going to be displaced, are going to have the more impact. As scientists mentioned decades ago that we were going to be living this massive extinction of mammals, scientists are also saying that in the next couple of decades, we'll need to completely mobilize countries because many of them are going to be underwater. And yet, perhaps of the way capitalism works, we tend to think so much on now and not in our intergenerational responsibilities. And you look at the political debate, and I've heard things like, well, yeah, climate change matters, but if you had to make me choose between feeding my country now or having the extinction of animals, well, let's have the extinction of animals. We need to feed people now. But that's not even the correct framing of the problem. Or people saying that the only possible way of growth is linked to fossil fuels. In stating that and saying that, and we've been repeating that, like if there was an antagonism between growth, sustainable growth, or between growth and sustainability. And many people believe that as a framework. Because if we call a country developed, and it has developed through fossil fuels, we equate that that's the only way to become developed. And such a simple framework of thinking has caused so much damage because we conclude that therefore it's not possible to grow and to thrive without burning fossil fuels. And then again, how can we translate these kind of discussions in an empathic way to make good change occur and to persuade people across the globe and to cut that divide, make that gap smaller, to instead of have polarization, have unity on people working together in terms of saving the planet, of making the life better for people. How can we do that? I think that's one of the greatest questions that humanity has in front of us. So going back to the beginning, science and human rights are the greatest achievements of humankind. But I do believe, and particularly for people like us, and I mean the ones in this room, that believe in that and believe on doing good for others. And I say that because if you get into public health, you're into that. That's your business, yeah. And I can say that after the pandemic, I can say it doubly, it's true. It's a sacrifice. But if you are into doing well for people, we need to add to that equation empathy, connection. People are not going to change behaviors just because science and the smart guy or girl in the room said so. We need to be empathic. We need to help figure that future that's good for all of us. I believe that's the only way we could do that. And a good way of saying that one can be empathic, it's about love. Working with love. Bringing love back in the equation. When you see so much hate going on all day, particularly over here, and we are all over here all the time. I heard one great phrase saying recently that this has brought us together, particularly the ones that are not present, but it makes us far away from the ones we have just beside us. That's so true. If we bring love again into the equation, not only by doing what we love, but loving those who are the target of what we do, I think that could be a good point of start. Bringing love back into the equation to what science and human rights points to be the right direction. Let's put a lot of empathy and love into that. Thank you again for inviting me. It's been a real pleasure.